Disability is a fact of life for millions in the U.S. Some have disabilities from birth, but more are experiencing disabilities in their working age years. Hi, I'm Ron Wirtz, editor of the fedgazette, and I'm here to give you a macro view of disability trends in the 9th District. There are two large federal disability programs that provide cash and health care benefits to individuals with a disability. First, there is Social Security Disability Insurance, or SSDI. This is part of the same program that provides retirement income for seniors. The other program is Supplemental Security Income, or SSI, which helps those with a disability who are also in poverty. Together, these two programs pay benefits to about 18 million people nationwide with disabilities. Both programs have seen significant increase in beneficiaries. SSDI is the larger program and has witnessed faster growth. In the 9th District, SSDI worker beneficiaries grew by almost 70% from 2002 to 2013. And every district state saw growth of about 40% or more. That compares with about 60% growth nationally. SSI recipients grew at a more modest 37% district-wide over this same period, but that was also higher than the national rate. Costs for both programs have grown considerably. SSDI cash benefits in district states have risen more than 90% in real terms since 2000, reaching $5.3 billion in 2013. Nationwide, over $140 billion was sent to beneficiaries that same year, and that doesn't include health care bills of about $70 billion. Total disability costs for SSI are only slightly lower. Rising disability rates have also had a notable effect on the labor force. In 2013, more than 8% of the U.S. working-age labor force received disability benefits, up considerably from a decade earlier. Rates in the 9th District are lower, but nonetheless saw a similar increase also. Rising disability rates offer at least a partial explanation for steadily declining labor force participation. Calculations by the fedgazette suggest that labor force participation in the 9th District in 2013 would be higher if disability rates in 2002 or 2007 had remained steady, all other things held constant. Disability rates also fluctuate widely within states. For example, SSDI rates are higher in northern counties in Minnesota, Wisconsin, northwest Montana, and all of the Upper Peninsula of Michigan. These high disability regions tend to have higher than average unemployment. Among the 9th District's almost 300 counties, there is a strong correlation between unemployment and disability rates. A number of factors are behind the steady rise in disability among working-age adults. Demographics make up a big share of the rise. The workforce is getting older, for example, and more women have entered the labor force and become eligible for disability benefits. Over the past few decades, program eligibility has also expanded. Some conditions that are harder to verify, like back pain, are now eligible, and vocational factors like available jobs and low skill levels are now considerations during benefit determinations. As a result, applications and benefit awards tend to increase during recessions when workers have more difficulty finding and keeping jobs, which make disability benefits more attractive. Finally, disability recipients are increasing because of very low termination rates. Once a person qualifies for disability benefits, they rarely leave due to a return to work or an improvement in their medical condition. This stems, according to sources, from tight caps on work earnings and the desire of many recipients to keep critical health care coverage through either Medicare or Medicaid. Mark Kennebeck is representative of millions of workers both helped and hampered by federal disability programs. Kennebeck has Apert syndrome, a genetic disorder which affects his head and face, among other things. This disability qualified him for SSDI, which he calls a lifesaver.
I think part of the problem with the insurance as well is they take one look at me and they're like, okay, this says it'd be expensive, this ain't good. If it wasn't for SSDI, I'd be living in a cardboard box and eating ramen noodles all day.
Kennebeck previously worked at Best Buy and now works part-time as a personal care assistant. He finds himself always vigilant about the hours he works.
I love it, but I gotta keep Social Security in mind. I can't make over $1,000 a month, which frustrates the hell out of me. If you make over $1,000 a month, you off. And it's a pain in the butt to get back on. And for someone like me, I need that.
These and many other issues related to disability are discussed in the articles nearby in the January issue of the Fed Gazette. Thanks for watching, and remember to follow us on Twitter.